Hello, my name is Dr. Don Buford, and this short 10-minute video clip is demonstrating our ultrasound-guided PICA technique for aspirating bone marrow from the posterior iliac crest. PICA stands for Posterior Iliac Crest Aspiration. Here you can see we have the patient comfortably positioned in the prone position. We're using an ultrasound machine to identify the posterior iliac crest. Once you identify the crest, we use a surgical marker just to make that X pattern or that cross pattern, which is basically our bullseye to place our needle, to place our initial lidocaine to numb up the subcutaneous tissues. Once you identify the most superior aspect of the posterior iliac crest, about 2 centimeters proximal to its inferior extent, we take that 22 gauge needle, we take it straight down through subcutaneous tissues until we can feel the actual bone, the periosteum of the posterior iliac, and then we inject 20 cc's of, this is 1% lidocaine with epinephrine. We take care to anesthetize the deep tissues as well as the superficial soft tissues. Probably the most important thing to do at this point is to give this injection 4 or 5 minutes to set up so that the patients are properly anesthetized before the rest of the procedure. Here you can see our table. This is our Mayo stand. With this particular patient, we were enrolling this patient in a study comparing 2 commercial bone marrow aspiration units. You can see our sterile draping and our sterile probe cover. And now we're going to, once again, we've identified or are about to identify the most superior aspect of the posterior iliac crest, about 2 centimeters superior to its most inferior aspect. And then we'll take that 11 blade and make a small stab incision in the skin, just big enough so that we can get our bone marrow aspiration needle through the skin. We use ultrasound to make sure that we're making our incision directly over the bone. We can also even leave in the needle from our lidocaine injection to serve as a guidepost for where we need to make our skin incision. After making our skin incision, we'll go ahead and take our bone marrow aspiration needle. Notice we're just twisting it through the soft tissues and through the superficial layers of the back down to the bone. Usually you'll come into contact with the posterior iliac crest between 2 and 4 centimeters from the skin. You can use your ultrasound to determine the depth at which you expect to hit the bone. In addition, you have the tactile confirmation of using the lidocaine needle to also hit the bone, so you know exactly your depth here. Once we have the needle directly on the bone, we gently feel the medial and lateral aspect of the iliac wings, taking care to identify this so that we don't aim medially and that we have our needle aiming straight vertical or preferably in a slight 15 to 20 degree lateral orientation. With proper placement using the guidelines in our PICA technique, a straight vertical approach is safe and allows you to comfortably enter the iliac bone to a depth of 4 to 5 centimeters routinely. Once we're comfortable with our placement, you can see that we're not using a drill, we're not using a hammer or mallet. I like stabilizing the needle with my non-dominant hand. These aspiration needles have 1 centimeter markings on them, so by checking the level or the markings on the needle in conjunction with my left hand in this video, I can tell when I've entered the bone 2 centimeters. At a depth of 2 centimeters, we can begin our aspiration, but we just gently rotate the needle until we have our depth down to 2 centimeters into the bone. Notice that I'm basically aiming for a straight vertical insertion of the needle. Again, if you're going to offset or angle your needle, you want to angle towards a lateral direction up to about 20 or sometimes even 25 degrees if you're starting on the most superior aspect. Once we're 2 centimeters into the bone, we will remove the stylus. At this point, we let the patient know that they can expect to feel a slight pop as there's an equalization of pressure from the intraosseous bone to the atmospheric pressure. Patients feel that, so we let them know to expect it. And here's how we insert the needle under manual power. Because we don't use a mallet or a drill, the patients don't feel any vibrations in their pelvis. It's usually pretty well tolerated, assuming that you've given the local anesthetic time to set up. And again, that was 20 cc's of 1% lidocaine with epi. This whole procedure of getting the needle to enter the bone varies on the density of a patient's bone, but on average we're able to get this done within 1 or 2 minutes in real time. I like having manual power here because some people will have softer bone, some people will have more dense bone, and by using just my hand I can feel the difference and make adjustments appropriately so that we don't have any untoward events. Now the next part of our PICA technique, here we remove the stylus, and next we'll start our aspiration. We use 10 cc syringes. Each syringe is preloaded with 1 cc of ACDA, and we then draw in each syringe up to a total of 6 centimeters, correction, 6 cc's of bone marrow. That gives us a total of 7 cc's in each 10 cc syringe, 1 cc of ACDA and 6 cc's of marrow. After the first syringe, we rotate the harvest needle 90 degrees and draw a second 6 cc's of bone marrow. So that gives us 2 draws at that level. We then place the stylus. This is the sharp stylus. We go slowly so patients aren't uncomfortable. And then we advance the needle 1/2 centimeter deeper into the iliac wing. This gives us a new harvest site, and from this new harvest site we harvest another 6 cc's into one 10 cc syringe, and then we will rotate the needle 90 degrees and harvest a second 6 cc's of marrow into a 10 cc syringe. And remember, these syringes are already preloaded with 1 cc of ACDA in each 10 cc syringe. Notice that we don't have to continue using the ultrasound. Once we've got the needle in the bone, we're essentially done with the ultrasound guidance. Here we are turning the needle 90 degrees to angle the opening in the ports in our distal needle so we can aspirate from a different site. And notice we're not filling the 10 cc syringes completely. We're trying to maximize our suction and our jerk pull pressure in this marrow aspiration to maximize our total nucleated cell counts and hopefully our stem cell counts. Now in this patient, because we're going to harvest another 60 cc's of marrow, we're going to move approximately 2.5 centimeters proximal and do the exact same procedure on the same left side of her posterior iliac crest. So we've made a second incision in the skin. We've measured that to be at least 2 centimeters, preferably 2.5 centimeters more superior. We use ultrasound once again to make sure that we're centered over the posterior iliac crest. And then here we are just gently rotating the needle down until we contact bone. You may want to do a second lidocaine injection here if the patient is no longer anesthetized. And then the rest of the technique is exactly the same. We've studied this and we found that it allows us to maximize our total nucleated cell counts and to obtain, in this example, 120 cc's of marrow from the same side of the patient without going through more than 2 separate entries into the posterior iliac crest. Once again, when we remove the stylus, we take care to warn the patient they're going to feel a little pressure, and then we go through our PICA technique with our 10 cc syringes, drawing 6 cc's of marrow into each syringe, and then rotating 90 degrees at each level. after each 2 syringes, we advance a ½ centimeter deeper. So our total depth ends up being 3.5